Welcome to this explainer. Look, if you're a parent, you absolutely know the feeling. Your kid runs up to you, holding their head, complaining that it hurts, and bam, your mind immediately jumps to the absolute worst case scenario. It's this immediate gut level worry that literally every single parent feels. It's incredibly tough to see your child in discomfort, and honestly, it's completely natural for your mind to just start racing with a million different terrifying possibilities.
You instantly start wondering, right? Like, is this just stress from a really busy school week? Maybe they just didn't drink enough water out at recess. Or, wait, could this be something much more serious? I want to validate that fear for you right out of the gate. It is so normal to ask those questions. But rather than letting that worry completely take over, let's look at what the medical data actually tells us. In this explainer, we're going to break down the most common causes of childhood headaches, the healthy daily habits that can actually stop them before they even start, and, most importantly, the specific warning signs you should absolutely never ignore. Okay, let's dive into this roadmap for today. First, we'll look at common childhood headaches. Then, we'll cover healthy habits for prevention. And third, warning signs to watch.
Starting with Section 1, Common Childhood Headaches. We're talking about the usual suspects here: tension, migraines, and standard illness. First off, take a deep breath. The vast majority of childhood headaches are totally harmless. Kids get headaches just like we do. Now, what's really interesting about this slide is how clearly it contrasts the two most common types. First, you have tension headaches. These kind of feel like a tight rubber band is just squeezing the head. It's usually a mild to moderate pressure, and the good news is it usually gets much better with a little rest. Then you have migraines. These are a whole different beast. They typically feel like a deep, throbbing pain. Plus, migraines very often come with a distinct sensitivity to light or sound, and sometimes even things like nausea or vomiting. So tension headaches are by far the most common type we see in kids. And honestly, when you look at the triggers, it makes perfect sense. We're talking about stress, and yeah, just navigating middle school friendships is incredibly stressful. Tiredness, poor sleep, and of course, way too much screen time. Migraines, on the flip side, have a really strong genetic link. So if you get them, there's a good chance your child might have inherited that tendency, even at a super young age. A really clear behavioral clue to watch out for is how your kid reacts to their environment. If they suddenly just want to go lie down in a dark, perfectly quiet room, that sensitivity to light and sound is a classic, really strong indicator of a migraine. There's also a third category we really need to define, and that's temporary headaches. This is just short-term head pain caused by things like a basic fever, a standard viral infection, skipping a meal, or simply dehydration. Actually, here's a kind of wild fact. When a child is dehydrated, the brain can actually temporarily contract away from the skull, and that's what causes that throbbing ache. The reassuring part, though, is that treating the root cause, like just handing them a giant glass of water or bringing their fever down, often makes the headache fade away almost instantly. Let's move to Section 2 and see how this builds into healthy habits for prevention. These are simple daily routines to reduce headaches. This is where we actually get to take back some control over those headaches. It all starts with basic fuel, making sure they're hydrating consistently throughout the day and absolutely never skipping meals. Then it's about energy balance, getting them outside for regular physical activity to just burn off that pent-up stress while simultaneously limiting their screen time. And finally, wrapping the whole day up with a really consistent sleep schedule. Just gently guiding these basic everyday habits can drastically reduce how often they're getting head pain. Let's really emphasize this specific rule for a second. Limit screen time to less than 2 hours per day outside of their normal schoolwork. I know it's tough, but in our digital world, excess screens are a massive trigger. Staring down at tablets forces their little necks into this awkward downward posture. It's actually called tech neck. That posture constantly strains the muscles right at the base of the skull, which feeds directly into those common tension headaches we were just talking about. And this brilliantly illustrates exactly how much sleep kids actually need, because sleep is honestly one of the most vital factors in preventing headaches altogether. Look at how the needs change as they grow. Preschoolers, they need a solid 10 to 13 hours. School-age kids need about 9 to 12 hours, and teenagers, even though they will absolutely fight you on this, they still need 8 to 10 hours a night. Staying up late and just having a generally irregular sleep schedule are incredibly common headache triggers. They desperately need that consistent restorative rest.
Now, I have to give you a quick but absolutely vital warning about treatments. While simple, over-the-counter pain relievers are great and can certainly help when you use them correctly, overusing them can actually make the headaches worse. No joke. It can lead to this awful cycle of what doctors call rebound headaches. That's where the brain essentially becomes dependent on the painkiller, and just the act of withdrawing it triggers a brand new ache. So always make sure to follow standard medical advice and medication guidelines.
Moving into Section 3, warning signs to watch. These are the serious red flags that do need medical attention.
So the crucial point is knowing how to separate those everyday aches from the true red flags. While we know most headaches are perfectly harmless, these are the rare, highly specific signs that you must never ignore. You need an immediate medical evaluation if a headache is sudden and intensely severe, or if the pain is so brutal it actually wakes your child up from a deep sleep. You also want to watch for neurological signs, things like weakness, trouble walking, sudden behavioral changes, repeated morning vomiting, or seizures. And absolutely always seek care for a headache that pops up right after a head injury, one accompanied by a fever and a stiff neck, or any headaches that are just progressively getting worse and worse over time. Okay, let's take a collective deep breath though. Because the ultimate good news here is that most headaches in children are simply not dangerous. Knowing those rare red flags takes all the terrifying guesswork out of parenting. When you know exactly what the true medical dangers look like, you can handle those everyday tensionette headaches and dehydration aches with total confidence and calm. Which leaves us with this final, somewhat provocative thought. Are your child's daily habits setting them up for success or setting off their next headache? As a parent, you have this incredible power to help them hydrate properly, to sleep better, and to step away from those glowing screens. Take charge of those healthy lifestyle changes today, and you might just make those childhood headaches a thing of the past entirely. Thanks so much for joining me for this explainer.